All right, well, joining us is someone whose job it is to help us kick the habit. Dr. Marion Adler is at Clamart Hospital in the suburbs of Paris. Thank you for speaking with us here on France 24. Did San Francisco do the right thing?
No, surely not. Well, the Food and Drug Administration, I think they didn't ban the cigarette, the real cigarette. So why should they ban the e-cigarette before the cigarette? We know that cigarette is very dangerous. The normal, regular cigarette causes cancer, but also stroke and cardiovascular disease. And you can have a big problem with your breast also. So breast cancer and breathing. But the vaping is something else. You don't have carbon monoxide, you don't have the smoke. And so it helps a lot of people to quit smoking. So of course it is helpful for people to quit smoking if they want. They have the NRT, nicotine replacement therapy, so that's the treatment. They have the varenicline, it's also a treatment. The treatment now is completely reimbursed in France. Both the treatment are reimbursed in France completely if you have a prescription. Some people are quitting with vaping. So it's very important to leave it for the people who are smokers and want to quit smoking if they are helped by the e-cigarette.
Yeah, a broad survey coming out here in France that shows 49% of the respondents said they chose vaping as a way to quit smoking.
Yes, and we can see now that it's decreasing the people who are smoking. And maybe it's also because of the vaping, because they find that vaping is helping them. I have some people in my consultation who are not completely 100% helped by vaping, so they can also use vaping and the normal treatment like NRT, nicotine replacement therapy. This is very helpful also. Some people, they don't like vaping, but a lot of people now find that it is really helpful to quit smoking. So what I advise to my patient is to take it to quit smoking, to completely quit smoking for a month, and afterward they will, little by little.
And what have you found? Are they able then to quit the vaping habit?
Exactly.
They are. It's easy.
They are. It's very easy. You can also be helped by the NRT, but it is easy if you decrease slowly the nicotine into the e-cigarette, but you first decrease the habit of taking the e-cigarette. And then it's much easier this way. And it's much less addictive than the cigarette.
Over how long a period do you need to do it?
Well, it depends on everybody. And what I do always, and I tell my patient, I will follow you. It's not the contrary. So I will not say after 3 months or something like this. I will see how the person is and how are the people feeling. And if they feel absolutely without withdrawal and without wishing to go back to the cigarette, then we can decrease slowly the e-cigarette. But it goes much easier than the cigarette. What I will not advise, of course, is for a young man or woman or young people to go to the e-cigarette. A non-smoker, I will not advise.
That's my question to you, because what set off the alarm bells in San Francisco and across the United States is this statistic of 78% spike in teenagers starting e-cigarettes. So is it the other way around? Could e-cigarettes, in their case, be, if you will, a platform to then move on to regular cigarettes?
Well, my concern is that they don't go to the cigarette. And you have a very, very few young people who are smoking in the United States if you compare with France. So that's a big difference. Here we have more than 50% of the young people who are smokers. So we have to help them. And we can help with the normal treatment, but also sometimes it's much better with the e-cigarette. So I agree that the young should not, but it's even much better to take the e-cigarette than the normal regular cigarette. Now the problem is to do a big advertising about the e-cigarette and to encourage the young people to smoke the e-cigarette, to take the e-cigarette. This is not what I am for. But if they take out the e-cigarette, they will go to the normal cigarette, the young people. This is really my concern.
And just to be clear, is vaping bad for young people's health?
Well, it's much, much less harmful than normal cigarette. The normal cigarette can give to the young people, it's a risk factor for the breast cancer, for example, for a cardiological problem.
Cardiovascular
disease, yes. And so it's really important to know that vaping is not smoke. What is dangerous is the smoke. So I would say, okay, it's not good that they try, but it's better they try e-cigarette than cigarette. So to say it's forbidden now, I think it's a big mistake for the health. I'm concerned about only the health.
Is there no danger for
I will not say it's no danger. What is not dangerous is to breathe normally the atmosphere and the normal air. That's for sure. But if you take something, it is much less dangerous to take the vaping than to take the normal cigarette. So the e-cigarette or vaping is much less dangerous. If you look at the studies in England, they can say it's around 95% less dangerous to take vaping than normal cigarette. So I think we have to help them, to encourage them, but surely not to say no more vaping. Then why the cigarette is still there? Is the alcohol not dangerous for the young people? Do they forbid completely the alcohol? I think we will remind on some years ago when it was completely forbidden and maybe not so helpful. So for the moment, e-cigarette doesn't seem to be dangerous at all. Well, it is more dangerous than to breathe normal air, I agree, but in comparison with the cigarette, and you have really to have in your mind the cigarette, it is much less harmful. But of course, I will not encourage young people to take the e-cigarette, also not.
All right. Dr. Marion Adler, many thanks for joining us.
Thank you very much.